For couples yearning to experience the joys of parenthood, the journey can sometimes be challenging. In vitro fertilization, commonly known as IVF, stands as a beacon of hope, offering a pathway to overcome infertility and fulfill the dream of having a child. This remarkable procedure involves a meticulously orchestrated series of steps, each playing a crucial role in facilitating conception outside the body. IVF involves retrieving mature eggs from a woman's ovaries and fertilizing them with sperm in a laboratory setting. This controlled environment optimizes the conditions for fertilization, increasing the likelihood of successful conception. The resulting embryos are then carefully nurtured and monitored before being transferred back into the woman's uterus with the hope of implantation and the beginning of a pregnancy. The journey through IVF is a deeply personal one, often filled with a mix of emotions as couples navigate the complexities of assisted reproduction. Understanding each step of the process can empower couples with knowledge and alleviate anxieties, fostering a sense of hope and optimism throughout their treatment. In the following sections, we will delve into the details of each stage of IVF, providing clear and reassuring information to guide you on this extraordinary path toward parenthood. The IVF journey begins with a critical step known as ovarian stimulation. This stage focuses on encouraging the ovaries to produce multiple mature eggs, significantly increasing the chances of successful fertilization. During natural menstrual cycles, a woman typically releases only one mature egg each month. However, in IVF, maximizing the number of eggs retrieved is essential, as not all eggs will fertilize or develop into healthy embryos. To stimulate egg production, fertility specialists prescribe injectable medications containing hormones that stimulate the ovaries. These medications, known as gonadotropins, mimic the naturally occurring hormones, follicle-stimulating hormone, FSH, and luteinizing hormone, LH, responsible for egg development and release. The dosage and duration of ovarian stimulation vary depending on individual factors such as age, ovarian reserve, and medical history. Throughout the stimulation phase, regular ultrasounds and blood tests are conducted to monitor the growth and development of the egg follicles within the ovaries. These monitoring appointments allow the medical team to track progress, adjust medication dosages as needed, and determine the optimal time for egg retrieval. The entire ovarian stimulation process typically lasts between 8 to 14 days, culminating in the crucial egg retrieval procedure. After careful monitoring and preparation during the ovarian stimulation phase, the next crucial step in the IVF journey is egg retrieval. This minimally invasive procedure aims to collect the mature eggs from the woman's ovaries, ready for fertilization in the laboratory. Performed under sedation to ensure maximum comfort, egg retrieval is a relatively quick procedure, typically taking about 30 minutes. Using ultrasound guidance, a thin needle is gently inserted through the vaginal wall and into each ovary. The needle is connected to a suction device that carefully aspirates the fluid-filled follicles containing the mature eggs. Once the follicles are aspirated, the collected fluid is immediately passed to an embryologist in the laboratory. The embryologist carefully examines the follicular fluid under a microscope to identify and isolate the retrieved eggs. The number of eggs collected can vary depending on factors such as the woman's age, ovarian response to stimulation, and the skill of the medical team. After retrieval, the eggs are carefully transferred to a specialized incubator that mimics the conditions of the female reproductive tract, providing the optimal environment for fertilization. Section 4. Where life begins. Fertilization in the lab. Following the retrieval of mature eggs, fertilization begins in the lab. Embryologists facilitate the union of sperm and egg, starting embryonic development. Two methods are used: conventional insemination and ICSI. Conventional insemination places sperm with eggs in a culture dish. Sperm naturally fertilize the eggs. ICSI injects a single sperm directly into an egg. This maximizes fertilization chances. Fertilized eggs, now zygotes, are monitored for signs of fertilization. 2 pronuclei indicate successful fertilization. Section 5. Welcoming new beginnings, embryo transfer and beyond. After fertilization, embryos grow in a specialized incubator, simulating the womb. Embryologists assess growth, selecting the most viable embryo. Embryo transfer, done between 3 to 5 days post-fertilization, is a key IVF milestone. A thin catheter deposits the embryo into the uterus. After the transfer, rest is advised. The wait can be both exciting and anxiety-provoking. 2 weeks later, a blood test checks for pregnancy. A positive test marks the start of a hopeful new chapter.